Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Balodi. And today's topic is one that, boy, we don't talk about enough. We've done a couple of podcasts in the past about the topic of grief, but I think that, it's so important for us to remember really how common grief is for so many of our families, family members, caretakers, things like that. And I think it's so important. And I have someone on the podcast today that I think is going to just do a wonderful job kind of describing her own experiences, and I'll probably share a little bit of my own as well as we go through this podcast. But before we go too far into it, Tracy Pellegrino, who's a social worker, program coordinator for the Smile Stella Tremonti Down Syndrome Clinic with Advent Health, is here today to join us. Tracy, would you mind just introducing yourself, who you are, what you do, why you love working with this population?
Thank you. It's so great to be here. Like he said, I am the program coordinator and social worker with the Smile with Stella Tremonti Down Syndrome Clinic. We are the only lifespan Down syndrome clinic that provides primary care in the Southeast United States.
Hmm.
We're about 2.5 years old, and we're really excited and growing like crazy, as you can imagine. I have a son that is going to be 16 in June, that has Down syndrome. And, he, of course, is part of the reason why I'm here today. I think that, the more that I work with families and learn about their stories and their journeys, the more it helps me become better at my job. And I'm just really excited to be able to share some of that with everyone.
I appreciate that. Yes, yes, yeah. Grief is something that I think for so many of us, we think it's important for us to hide it away and not talk about it, and we might what might we do for people if we were to share our struggles, would we maybe influence them one way or another in the way that they're experiencing their life, and boy, I think one of the things that I've discovered, even just emailing back and forth with you, Tracy, is that you've really highlighted the importance of sharing what we're feeling and the actual emotions that we're feeling, and I think that's so important. So as we get into this podcast, I was wondering if you wouldn't mind just sharing a little bit, as much as you feel comfortable, sharing a little bit about your story and what brought you to being a guest on the podcast today as we talk about grief.
Sure, thank you. I don't think my full story is overly unique. I know a little bit more about grief than some, and surely less than others. I've had a failed marriage. When I finally found love again, I had two prenatal losses and then became a widow when my children were 16, 4, and 2. And a couple of years ago, lost both of my parents within 9 months or 9 weeks of each other. But I'm not really here to talk about those things, but really just to open up the conversation and make it a safe place to talk about grief and to understand the different moments throughout the journey of being a caregiver of someone with a disability. And, most importantly, hopefully we can share some things on how to find joy in the midst of that grief. Um, so I got the diagnosis of Down syndrome with my son at 19 weeks gestation. And, as I had mentioned, it was followed after we had already lost two pregnancies. So this was difficult news, but it did help to have that information ahead of time so we could have time to prepare for this new journey, and to grieve. And we did grieve, but we grieved quietly and privately, never publicly. We didn't want anyone to think um, that we were not grateful to have a new life. We certainly didn't want anyone to think that we couldn't handle it. We certainly didn't want anyone to pity us or to place judgment, and to show that we were vulnerable and worried. So we didn't grieve publicly.
Mm.
And that was kind of that first grief moment in our journey, and little did we know that that was the easiest one to get through. And as time has gone on, there's been so many little moments throughout this journey, and we're, not even all the way through it, obviously, that we have had to learn to pile those moments on top of each other and learn how to exist and carry it with us. We embraced ourselves into the Down syndrome community. And for any of you that have that experience, you get embraced and told
Hmm.
all will be okay, that all the babies will, grow up. Most of them grow up to be healthy and go to school, get jobs. Some have families. And people with Down syndrome are happy and joyful, and they bring out the best in the world. And you're so lucky to have been chosen. We drank that proverbial
Hmm.
Kool-Aid and we puffed ourselves up and educated ourselves, and we were ready to overcome this. And we were certain that our son would be one of the high achieving ones because we got all the information ahead of time. We were ready. We, had our connections. And for the most part, when he was born, it was kind of true, even though he had a significant heart defect that we were ready to prepare for. He didn't spend one day in the NICU. We worked very closely with our pediatricians, and we went to all of the specialists, started therapy immediately. He even had his heart surgery at 10 months with no complications. And, if you looked at him, he didn't look that much different than a typical baby does. And for the most part, he developed his milestones within the normal-ish limits. And, we patted ourselves on the back
Hmm.
and thought we have overcome this hiccup. And even when the we became me after my husband died when Lucas was 2, I still continued on, and Lucas went to a typical daycare where everybody loved him and therapists were able to come to the program. Um, the truth is, though, when I look back, I spend a lot of time crying in the shower,
Hmm.
and I had a lot of really rough times.
Hmm.
Um, but again, because everyone expected me to keep moving and, didn't want the judgment, I pulled myself up and went on living. And he did fine
Hmm.
until what I call kind of my big grief moment, or the biggest grief moment in the journey of where things started shifting, is it was time for preschool. In Florida, all kids age 4 can enroll in free voluntary preschool. Lucas's daycare had the program, and I was so excited that he could stay there and be part of the same school, and everybody loved him. But the director there said no, he couldn't
Hmm.
go. And that's when it hit me that I have a child with a disability, and this journey is going to be really hard.
Hmm.
And she said no because she didn't want their data to be thrown off by having a child that couldn't reach the developmental milestones during that VPK program, and be in a small school, they couldn't risk losing funding.
Hmm.
So that really was where the pivoting time happened. And, this was followed by then kindergarten, not getting the accommodations he needed, having to leave the school he was zoned for, going to 3 different schools to find a good fit, which really didn't happen until middle school. Losing a lot of friendships because of his behavior. He was a very busy boy. He eloped. He didn't play with the other kids like the other kids do, didn't follow standard rules. People didn't understand what he was communicating. Adults were thinking I was being elusive or avoiding them because I had to stay on him, give him, close attention. I couldn't just let him rush off and play with other kids. So, our world became smaller and smaller and smaller.
Hmm.
He had a lot of medical anxiety, so we weren't able to travel, or he had a lot of medical vulnerabilities that kept us from traveling, and anxiety that kept him from certain treatments that he may need. We couldn't get like a sleep study done for him until he was actually 14 years old, which impeded a lot of medical support that he really needed and caused him to be hospitalized more often than he should have been. Um, so there were just so many things that we missed out on or lost or couldn't do. Um, and even now I anticipate so many more coming as he transitions from high school. He's already talking about dreams that he has, of things that he wants to do. And I'm not sure he's going to be able to do them.
Mm.
He watches his older brothers leaving home, driving, working, going to college. Eventually, I assume they'll get married, and have kids. Um, and so I'm not even just dealing with my grief of the things that he's not going to be able to do, but will and am starting to deal with his grief too.
Yeah.
It wasn't until he was about 13 that he recognized that other people have fathers and he didn't. And so helping work through that with him, which was, and is challenging. Um, and I know by talking to other parents, that we look towards the later years where there's more medical complications and dementia, changing in guardianship and living situations.
Hmm.
Um, there's just a lot of different things that are coming yet that we haven't faced yet that I see my friends starting to face. And it's tough. And we don't want to be the one that says we're going to grieve these moments. We want to just overcome them and keep moving forward and just put on a happy face. And I don't think that that's probably the best and healthiest way to deal with it, but to we have to walk through it and realize that these are significant moments and to pause
Hmm.
and grieve.
Yeah. Yeah. Boy, I really appreciate how you shared that, and I think it's so important too, right? As we all go through different types of grief in our life, that this tendency to try to compare our own grief to somebody else's grief. Well, I'm not that bad because it's not like that, and all it takes is a little bit of time with a therapist or someone who's a trained counselor to be like, "Wow, you're going through a lot," And I think that validation is so important. Yeah, you left where I am currently in terms of with my brother. Most of the listeners to this podcast know, and or I've heard my brother on this podcast before, and he just turned 51, and we're in the midst of at least 2 or 3 years now of my father having had significant decline in his health due to Alzheimer disease, and boy, is that relentless! It just keeps progressing and progressing, and
Mhm.
he's pretty much my dad, pretty much as far gone as you can be, yet still living and in hospice care. And my brother has always lived with my parents. That's really always been his desire. He loves living with family, and so our family plan has always been that. When my parents could no longer take care of him, that my older sister and I would take care of my brother in terms of living in our homes. And we didn't anticipate it being something like this, though, where it's been so drawn out, where, my
Mhm.
dad's technically still alive and my mom is technically still able to take care of my brother, but she's in her early 80s herself
Right.
and dealing with her own issues. And so there's that grief that that I feel as I'm grieving, the loss of my parents while they are still alive, and also the grief of watching my brother try to process this, and
Yeah.
that's very hard for him. It's hard for him to understand, why his dad not like he was before, and why is mom having a harder time with going up and down the stairs, and he's also at the same time, unfortunately, over the last year or so, started to show some early signs of dementia himself. My brother has, and I think that's equally, it's incredibly difficult in my line of work, and I'm sure in yours as well, where we're constantly meeting patients and families who are looking to hear good news, and so a lot of
Right.
the times families will say, "Oh, tell me about your brother. How's your brother doing?" And I want to be able to say, he's doing great, everything's great. But, he's at that stage in his life where even he's starting to kind of lose some of those mental faculties and the things that made him uniquely him.
Right.
He's starting to not understand the jokes that we're making, and not showing interest in the things he used to show interest in. And there's a grief that's there that, as you mentioned, is so easy to fall into the trap of I have to hide that. But one of the things that really struck me when we were emailing together was just how easy it is to kind of talk with you about those things as because you're also going through those things. And I guess that's where I want to really kind of transition as we go through this podcast is I wanted to get your idea, like a general discussion, like really about what is in terms of grief, how do we normalize it? How do we share those emotions together as a community? I don't know, big picture type stuff. Tracy, how would you approach some of those kinds of topics?
Well, I did a lot of thinking about this, and this is a lot of a message to myself because it's a daily struggle and reminder because I've always been a very goal-oriented person. I like to be in control. I like to know what's going to happen next. And the narrative I think throughout my life, and I think is common for most of us, is that, you just do it, you overcome, you get through it. But I heard a speaker speak not long ago, and they talked about instead of overcoming, that we need to focus on undergoing instead.
Mm,
So, like, if you look up the definition or Google undergoing, it'll probably be referenced to preparing for like a surgery or a procedure or something. And the part that I think strikes me the most is like you can't skip the tough spots.
mm,
You have to do it. You have to allow yourself to go through it. You do what you can to prepare, like we got information and gathered our people, but you got to go through it. And then you have to allow yourself to heal
mm,
after it. So when we talk about um, those tough times, to take a pause and own it when it feels tough, to confront that pain piece by piece, maybe even like um, we need to seek education on solutions, options, find people that are dealing with similar issues, and then really recognize when and where to get help if you get stuck. I tell a lot of our patients, especially the brand new ones with brand new babies that got their
mm,
diagnosis after they delivered, especially them, to let them know it's okay to
mm,
grieve what you didn't get.
mm.
I mean, this Down syndrome community is amazing
Yeah.
and so reciprocal and always there to celebrate all the things that our children and people with Down syndrome can and do achieve. If you've ever gone to any kind of fundraising walks for any disability of any kind, it's always talking about how to fix it and get rid of it. But
Mm,
with Down syndrome, it's to celebrate what is.
mhm.
And so they're really good at that. But that sometimes then overrides sometimes it's really hard
Yeah.
and it's painful and you still grieve.
Mhm.
So, but if you find yourself stuck there, then that's when it's time to ask for help. I also think that we need to work on rewriting the narrative of worth, that my son's worth is not tied to his success that is defined by others. And my success, this is the part that's hard for me, is not tied to his worth that's defined by others.
Mm.
And uh, I need to continue to work on letting go of control and looking back at what I believe is a success, what I believe a successful life should be,
Hmm.
and to see that there's a different narrative of success that is waiting.
I like that. Yeah. Thanks for sharing that. I think one of the things that I think comes through so clearly in your story and to some extent in my own as well is it's so important to be able to find those people who you can be open with, that you can share with them. There's this struggle that I'm going through or we're going through, and to be able to have that person say, "Yeah, I know. I understand that." And I think that's something pretty uniquely beautiful about this community too, is that if you find others who are siblings to adults with Down syndrome, like I love at the convention, you get to at the national convention that happens every year, you get to meet with people who are in a similar situation to you, and
Mhm.
you can say, "Oh, this is really hard," and they can say, "I know, it's really hard," and you can feel like I'm not alone in it, and I think that a lot of the times, I think, especially for those younger parents, like you're saying, it's so important for them to be able to be with someone who can say, "I remember I felt that too." I think that's really important.
Mhm.
Yeah.
And
Wow.
I'll bet
Yeah,
that
go ahead.
your grief
Hmm.
is different in many ways than mine,
Yeah.
because, and I don't know what it was like for you, but I know with my other sons, there are things that we haven't been able to do as a family,
Hmm.
or things that I didn't do for them because everything was focused, or so much
Yeah.
was focused around what Lucas could do or couldn't do,
Yeah.
or what we could afford to do because we were paying for therapies, or,
Hmm.
or hospital bills, or, whatever those things are.
Hmm.
And, I'm sure for other people around, even grandparents not wanting to say, I'm sad or disappointed that I didn't get the typical grandchild. But they don't want to say that out loud for sure, because they don't want the parents to feel bad. They don't want to be those type of grandparents, or
Hmm.
whatever it
Hmm.
is.
Hmm. Hmm.
And so I think that there's just so much more that we can talk about, and to bring out, of the different types of grief, um, that others are experiencing.
Yeah. Wow, thank you, Tracy. I mean, I feel like if I keep talking to you, which I could for the next hour, I'd probably have to get a bill in the mail for the amount of that you're helping me as I process through so many different things. Yeah, when you mentioned that, things you can't do, even as a child, I remember my kids always make fun of me because I don't know how to dance. I was like, I could have been in the school musicals and learned how to
Right.
do that stuff, but I had to be home and take care of your uncle. And I'm sure I never would have been a good dancer. But at the same time, there are those times where you're like, yeah, there are things that we had to give up as siblings, because my brother had some needs that needed to be met. And so, yeah, I appreciate you bringing that up. That sibling perspective, the grandparent perspective. I mean, I feel like there's so many different perspectives that we've talked about today. Well, Tracy, before I close the podcast, is there anything else that you wanted to make sure, or big picture point that you want to make sure that you leave with our listeners today, or do you feel like we've covered everything pretty well?
The only other thing is, I really want to encourage people to, as their time to heal, is to pursue joy, and
Mm.
different ways to do that. I call them lightning bug moments. When you can take a brief moment to enjoy a smell, a memory, or something beautiful. Everyone says, take time for yourself. Well, you don't have time. But there's those lightning bug moments of just enjoying something small and being completely in the moment then.
Hmm.
and celebrating the accomplishments. They slept through the night, a day when the school didn't call.
Yeah,
you
right.
know, a day that they didn't fight when we're trying to wash his hair, any of those kinds of things, just to really cherish those lightning bug moments and embrace the different narrative of success that is waiting because it really truly, even amongst the grief, there really are um, you know, it is a beautiful life. And
Hmm.
when you, if you've ever seen lightning bugs, they start out one and then another. And then a half an hour later, as it gets darker, the field is full of flickering lights. And the more that you can embrace looking for them, your field will be filled with those beautiful little specks of light, and you can find that joy amongst the grief.
I love that. Thank you so much. Well, thank you again for joining me on the podcast today, and really appreciate you sharing as you did. And I want to encourage our listeners to, whatever it is that you're feeling in these moments. Maybe you're going through some periods of grief yourself, and you're not sure, what to do, where to turn. I feel like it's just so important for us to find those. People are people who we can share things with, and we won't feel judgment, but rather feel that camaraderie, that we're not alone in that. And so I think that would be my biggest encouragement to our listeners today, is to find those people, oftentimes outside of our own homes, but just someone where we can feel comfortable sharing what's going on. And so thank you again, Tracy, for joining us on the podcast.
Thank you so much for having me. It
And
was
to
a
our
joy.
listeners, if there are any podcasts that you would like us, topics that you would like us to cover on this podcast, please go and send me an email to Down Syndrome Center at chp.edu. And if you would like to join us in the work that we do here at the center, including supporting this podcast, you can go to givetochildrens.org/Down Syndrome Center. But until next time, bye bye.